Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. You know, it's interesting, like when you read a book and there's kind of like the main character has all these traumas and all this stuff, you sort of know that the author probably knows somebody who went through that, or the author did. So you gotta realize when Dr. Hauser's talking about pediatric acute neuropsychiatric syndrome, you know, it's probable he's either had a bunch of cases with it or it's been mentioned. So just almost everything on this channel, it's just people that I've treated, you know, and then I'm often asked, you know, could prolotherapy help? So if somebody had a child who had an acute change in their personality and was diagnosed with PANS or PANDAS, and it keeps relapsing, it makes you think there has to be something in the condition or the cause of the condition that's not getting resolved by traditional medicine, right? Like a kid might get a streptococcus infection or some kind of upper respiratory infection, then all of a sudden they have an acute change in their personality, they get diagnosed with this condition, and then you think that, oh, the kid's just going to get on the antibiotics or whatever, and then they're going to be fine. Well, when they aren't fine or the things keeps relapsing, you know, that's when you're realizing, like, what the heck, what's going on? Maybe there's something more to the story. Well, if you look at autoimmune encephalopathy, and some people, that's how they would characterize PANDAS and PANS. You know, they have tics, they have obsessive compulsive, they have eating disorders, they have anxiety, and they have a lot of other symptoms that make you think that there's a subset of these kids that probably do have a breakdown of the neck curve, or they do have ligamentous cervical instability. Because always realize kids today, every other kid's got autism or autism-like spectrum or ADHD or PANS or PANDAS. Like, what's going on? Well, I think part of what's going on is the kids, they're not outside, they're not looking up, and they're looking down at cell phones and tablets, right? And even when they go to school, when I was in school, I always was looking up at the teacher. Well, now the kids are looking down at their tablet or at their cell phone. So that causes a reversal of the neck curve. You got to realize, kids, the smaller the kid, the heavier the head is and the littler the neck. Think about what I just said. Like a kid's 4 years old, right? Or they're 3 years old. They got this humongous head. They got this itsy bitsy neck. And if they're not looking up and using their muscles and they're looking down and their neck curve's getting reversed, it can cause all the things that I talk about in this channel. There's other videos on adults who all of a sudden had a personality change. They all of a sudden got obsessive compulsive disorder. They all of a sudden got anxiety. They never had anxiety ever in their life. And then it happened all of a sudden. They get their neck curve corrected. They get their instability treated with prolotherapy. Then the psychiatric things go away. So I'm telling you, all the things that are on this channel can happen with kids. And we have plenty of adults that have tremors, that have tics, that have obsessive compulsive. We have lots of digestive things, eating disorders, anxiety, depression, that we see in adults that we correct their neck curve and we resolve the instability with prolotherapy and they feel much better. Like basically, if you research PANS or PANDAS, you'll see that it's a dramatic sudden onset of obsessive compulsive disorder, restrictive food intake, and there's also other symptoms including like anxiety, emotional lability, irritability, school performance tanks, sensory or motor abnormalities like light sensitivity, sound sensitivity, touch sensitivity, sleeping disorders, urinary frequency, that the symptoms should not be explained by a known neurological or medical disorder such as different types of genetic choreas. Now, if I was a parent and if my child had this, of course I'd go to a pediatrician, of course I'd get checked out for various infections. But if the thing kept relapsing, I would absolutely look at neck problems, cervical destructure, ligamentous cervical instability. What is PANDAS or what's PANS? PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Streptococcus Infection. PANDAS is Pediatric Acute Onset Neuropsychiatric Syndrome. PANS is a clinical diagnosis that we talked about OCD and all these other symptoms. So they're pretty much the same, except this one you get a documented streptococcus infection that you normally document by blood tests. But the symptoms are the same. This explains some of the pathophysiology. Basically, in summary, if you really delve deep into this, something's causing acutely or subacutely for the brain pressure to go way up. So there's some type of inflammatory condition in the brain, or there's increase in fluid volume of the brain from jugular vein compression, causing the brain pressure to be high. When we talk about on this channel the high brain pressure, realize that brain pressure can be just on one particular part of the brain. So if it occurs in the temporal lobes, guess what? A person could get absent seizure, or all of a sudden the person could visualize something or smell something that's not there. Or basically the personality could change all of a sudden. The personality could change all of a sudden. So again, here's the criterion, the worsening of school performance. I've had people that were honor students in high school, and then literally overnight they can't even read basically. And then there's tests for streptococcus, and in PANDAS it's significantly different than in PANS. You know, they get cardiovascular tachycardia, they get depression, some of them can even get schizophrenia, anxiety. The most common are, in my opinion, is anxiety and depression. So there's either an infectious trigger, a non-infectious trigger. Obviously, I think one of the non-infectious triggers is simply looking down, humongous head, little neck, humongous head, little neck, and then the neck curve reverses and the person ends up with vagus nerve degeneration and jugular vein compression. I didn't put a lot of that stuff on this talk because I've talked about it many, many times in other videos. So if you're watching this video and you're seeing me for the very first time, see other videos on what vagus nerve degeneration causes, because the vagus nerves are what calm the body down. So you get massive anxiety, sleeplessness, if all of a sudden your body can't calm down because the vagus nerves are so damaged. And the jugular vein, that's how the brain drains normally during the night. So if you clog up or compress the jugular veins, your brain pressure goes up because 70% of the fluid volume in the brain is in the veins. So if the vein fluid can't go down, the brain pressure is going to go up, and brain pressure going up can cause anything. Visual symptoms, visual disturbance, blurry vision, hearing problems, personality changes, obsessive compulsive tics. And again, even COVID-19 infections or any sort of infection can acutely cause neuropsychiatric symptoms in kids. I started this by just saying, why are there so many more kids getting sick? I think what it is the kids' vagus nerves are so bad, their brain pressures are so bad. Like, in other words, the average kid in school probably already has a high brain pressure. Then they get a streptococcus infection. I had rheumatoid I had rheumatic fever when I was a kid. I had rheumatic fever. I had streptococcus rheumatic fever when I was a kid, right? I didn't get PANS or PANDAS, but I think if I was born now and I got rheumatic fever, I'd get PANS or PANDAS, right? Because my parents would have sat me right in front of a cell phone or a tablet, right? And I would have gotten vagus nerve degeneration. I would have had jugular vein compression, right? So my brain pressure is already high. Then the straw that breaks the camel's back. The straw that breaks the camel's back is the streptococcus infection. So in other words, the kid already had a physiology that made them prone to having a streptococcus infection or a COVID infection or an upper respiratory infection or a respiratory virus infection, RSV, all of a sudden it was a straw that broke the camel's back, and all of a sudden the kid changes crazily, their health deteriorates, and everybody says, oh, it was COVID, it was this or that. No, like back in the day, you know, kids just didn't get sick. They could get chicken pox, right? We didn't have a vaccine for chicken pox. Every kid got chicken pox. They didn't get any problems after that. Like, why are we having all these problems? It's because the kids, their necks are screwed up, their vagus nerves are screwed up, their brain's screwed up because they have a reversal of the neck curve, right? So long story short, like the jugular veins, that's what drains the brain. So if you have your atlas all forward, because the kid's like this, right? I see teenagers, they're walking around like this. Like their posture is so bad. So what do you think is going to happen to all the structures that are right here? They're going to get damaged and injured. And thus, when they do get an infection or they get hit with a basketball, like a little basketball, you know, they end up with all kinds of symptoms, vertigo, dizziness, heart palpitations, heart arrhythmias, my stomach doesn't work, autoimmune disease, endocrine problems, hearing problems. All these things stem from poor neck posture. So parents who have kids like this, just get an x-ray, get a cervical x-ray, and you'll be shocked at how horrible the neck x-rays are, just how horrible. Again, you basically get an infection and all these inflammatory things happen in the head, but the same thing happens when the metabolic waste products from all the activity, the kids are watching the cell phone, they're watching the tablet. So the brain activity is up and up and up and up. So there's all this metabolic waste product that's inflaming the brain toilet obstruction. Then the brain pressure goes up, the brain gets inflamed. So the infection may just be a red herring. It's not really the main problem, right? So could there be a structural neck issue contributing to pediatric acute neuropsychiatric syndrome? Quick personality changes, anxiety, sleep disorder, cognitive light and sound sensitivity, tics, tremors are all things that occur with ligamentous cervical instability. Relapses and symptoms occur in 89% of patients with PANS. So I mean the symptoms recur. Well, that's common with ligamentous cervical instability, right? It isn't like a kid has a seizure every day or tics every day. It comes and goes depending on how the cervical anatomy is. A kid could sleep wrong, then all of a sudden the jugular veins block more. They have a bad day where their personality is awful. The next day they sleep in the opposite position, the anatomy's better. Then the jugular veins are more open, then the kid feels better. Basically, ligamentous cervical instability, in my opinion, I wrote an article on how face down forward head lifestyle can obstruct the jugular veins. That's in Frontiers of Neurology. And if you research like jugular vein compression, you'll see that the brain pressure can go up and the blood-brain barrier can be broken down and you can get a lot of brain inflammation. So to make the diagnosis of PANS or PANDAS, there shouldn't be another condition that could be causing the child's symptoms, where I'm just saying maybe there is another condition, which is ligamentous cervical instability. So this is from our center. If you look at, this was in 2022. There was 931 new patients. Look at their symptoms. 67% sleeping problems. 71% anxiety. Some of the very same symptoms as PANS and PANDAS, and this is the brain toilet. You know, you have a face down lifestyle, could be in kids. You lose the cervical curve, you obstruct the veno-lymphatic drainage of the brain. You have basically a breakdown of the blood-brain barrier and you get all kinds of all that inflammation. Could it cause a personality change? I sure think so. And ligamentous cervical instability can cause all kinds of things. Jugular vein compression, carotid sheath compression, the vertebral artery, you can get dizziness. Especially if a kid has a clicky, poppy neck, they complain of neck pain, that would be a sign that They have a neck problem. Also, if they're tachycardic, like why is the kid's pulse so high? That would be another sign that there probably is a cervical instability problem. And this shows all the different ways that the jugular vein and the vagus nerve can be stretched and compressed. Forward head, the kid's got forward head. They have excessive thoracic kyphosis. They have a breakdown of the cervical curve. They have upper instability, lower instability, and then there's a couple other things. A lot of kids have jaw problems. The mandible is a mess. That can also block the jugular veins. And then when the jugular veins get blocked, right, basically the brain can't drain, so it tries to drain in the back here, but you got to get rid of this block here. So the way you get rid of that block there is to have the child look up, look up, look up. And if they're gonna look at a cell phone or a tablet, you got to have them laying down on their stomach. You got to have them laying down on their stomach. The way we document that the brain pressure is high is by optic nerve sheath diameter. This is an adult. Normal optic nerve sheath, you could see how large that is. So what happens is when you block the jugular veins, the fluid accumulates around the eye nerve, the cerebral spinal fluid. You can see that behind the eye. That's a sign that the brain pressure is high. When the optic nerve sheath diameter in adults is greater than 6.1, kids, there's different ages that it's normal, but in adults, if it's greater than 6.1, it means the brain pressure is above 20 millimeters of mercury. Brain pressure is supposed to be between 10 and 15. So again, high brain pressure can cause personality changes. So the treatment is you got to have a looking up lifestyle. Obviously, a 4-year-old, I don't want to start sticking needles in the neck. So we try to get the parents and the child to just basically have more of a looking up lifestyle. Other signs and symptoms that make you think that there might be a ligamentous cervical instability problem is there shortness of breath, is there difficulty swallowing, is there poor digestion? And again, looking up for the child, looking up lifestyle is healthy, looking down is illness. So if I had a child who had an acute personality change, I would get tested for streptococcus and I'd see a pediatrician. If it didn't resolve, that's, I would look at doing some, do a digital motion x-ray to look for bad changes in the neck structure, and if there is instability, then probably every month or two I'd get an x-ray to make sure that the neck curve is changing in the right way. Also on initial presentation, we do other tests like the optic nerve sheath. We look at, are the jugular veins compressed? Is the vagus nerve degenerated? And what we find is over time, those parameters typically improve also, and that correlates with the symptoms improving. Thank you so much for watching.